Welcome back to Simply Women's Health with CJ. Today we're going to talk about term pregnancy. You are officially term once your pregnancy has reached 37 weeks. Once you're term, stuff changes as far as what to look out for and when to be concerned. Right around 36 weeks, your provider's probably going to want to do what's called a Group B strep test. Group B strep is a normal bacteria. 25% or 1 out of every 4 people colonizes or grows Group B strep. It's a normal bacteria that's found in poop. Unfortunately, your booty and your vagina are right next to each other. So if you are a person who colonizes Group B strep, there's a good chance that the baby can come in contact with it. So we test every woman every pregnancy. The only caveat to that is if you had Group B strep in your urine culture at the beginning of pregnancy, we assume you're positive and we don't bother to do the testing. If you do need testing, your provider will use a Q-tip. It looks something like this, and they will go in your vagina, down by your booty hole, and they will send that off to the lab. Typically takes about 2 days to get those results back. If you are negative, no big deal. If you're positive, you will get antibiotics in labor. The antibiotics are not for you, they're for your baby. Again, Group B strep is a normal bacteria. We're not trying to get rid of it, we're just trying to protect the baby. Once you get to 37 weeks, your provider is going to want you to continue to do your fetal monitoring. However, your provider has recommended that you track your fetal movement. That's what I'm going to recommend you do. Once you get to 37 weeks, you are no longer preterm, so preterm labor precautions no longer apply. Now we're going to talk about labor precautions. If this is your first baby, you can anticipate the first stage of labor lasting somewhere between 3 and 30 hours. I usually tell my patients to anticipate 30. At the beginning, your contractions are going to be mild, and they're going to be all over the place. You will have a contraction, and then 5 minutes later another one, and then 25 minutes, and 3 minutes, and 17. They're going to be all over the place because the way contractions happen, there is a hormone that comes from your pituitary gland that tells your uterus to contract. Your uterus contracts, the baby's head pushes on the cervix tells the message, sends a message back to the pituitary gland to make more of this hormone called oxytocin. It takes a little while for this feedback loop to get going. So for first-time moms, again, those contractions are going to be kind of sporadic at the beginning. They're going to be very mild, and quite frankly, you're going to be excited. You're going to be, it's happening, I'm having contractions. Those are not the contractions that we are worried about. You need to let your provider know or contact your delivery facility once your contractions are every 5 minutes apart and you seriously cannot breathe or you cannot talk through them. You have to breathe in order to get through them. There are lots of apps that you can download that can track your contraction patterns, and some of them will even tell you when to call your provider or when to go into the hospital. Of course, if your baby isn't moving, you need to let us know. If you have water running down your leg that isn't urine. By term pregnancy, if you have not already sneezed and tinkled, seriously, it is just a matter of time before that's going to happen. You also need to contact your provider if you are bleeding like you are on your menstrual cycle. If this is a subsequent baby and you are having contractions that are so strong that you cannot talk through them, I usually tell my patients I have no such 5-minute rule with them. If you feel as though you need to get to the hospital, you call your delivery facility and let them know that you feel as though you might be in labor. Again, if your water breaks, if the baby isn't moving, if you are bleeding, you need to come on in. Third trimester, we're still on the lookout for preeclampsia. It happens in 15% of pregnancies. We don't know what causes it. We don't know how to prevent it. Women with preeclampsia have very high blood pressure, which is why you're being monitored more frequently in the last month of pregnancy. You are not tracking blood pressure all day, every day. Symptoms for you to look out for. The worst headache of your life. It won't go away no matter what you do. You take Tylenol, you drink water, you take a nap, nothing works. Changes in your vision, black spots, flashing lights, tunnel vision, primarily at rest. You bend over, you pick up something off the floor, you get back up, you get those shooting stars that go away in a few minutes. Those are normal pressure changes in your head. If you're just sitting there watching TV, minding your own business, and you start seeing these spots, again, you probably want to let somebody know. If you're having burning behind your right breast, normal heartburn is up here where your esophagus is. This is your liver. It should not be on fire. Now that you're at the end of pregnancy, it's time to start preparing to be a mom. Have you signed up for your prenatal classes? If this is a first baby, I highly recommend taking a tour of the facility where you're going to deliver, finding out what to expect in labor and delivery. What are your pain management options? If you're planning on breastfeeding, which I strongly encourage, if you can sign up for a breastfeeding class, those are invaluable for first-time moms. Do you have your support system in order? Who's going to take care of you after you have this baby? Do you have your car seat? If you're having a little boy, have you and your partner decided whether or not you want this little guy circumcised? So many decisions to make, and just get ready to be a mom. And congratulations from CJ. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.